And the U.S. president has often downplayed the virus. Just 3 days ago, at that debate, Trump mocked his challenger, Joe Biden, for his mask wearing.
I have a mask right here. I put a mask on, when I think I need it. Tonight, as an example, everybody's had a test, and you've had social distancing and all of the things that you have to. But I wear masks when needed. When needed, I wear masks.
Okay, let me ask.
I don't wear masks like him. Every time you see him, he's got a mask. He could be speaking 200 feet away from it. He shows up with the biggest mask I've ever seen.
For more, let's bring in CTV News infectious disease specialist, Dr. Abdu Sharkawy. Dr. Sharkawy, let's start with masks then, since that's become such a flashpoint. The fact that the president now has the virus, what does that tell us about his attitude towards masks?
Well, I think it's abundantly clear that this virus does not discriminate based on anything, whether it's affluence or political influence or anything else. The fact is that you have to respect its ability to be transmitted when you're within close range of other people. And also, the risk is not negligible. It's not absolutely zero, even if you're in outdoor settings and you are in throngs of crowds surrounding you, as has been the case for President Trump through much of this campaign. So if anything, this is a really important reminder of the vital importance of masking and the importance of all measures to protect ourselves and to prevent transmission of this virus. It's certainly a serious threat, no matter who you are.
Absolutely. And doctor, this is the most powerful man in the world who has the best and most advanced resources at his disposal. But clearly the screening tests surrounding the president didn't work, or they had holes in them, or people didn't abide by them. What's your take on that in terms of, this is a man who was allegedly tested every day?
Well, I doubt that that was the case, frankly. But generally speaking, in these sorts of scenarios, it's almost always a lack of adherence to one of the measures that I spoke of earlier, particularly masking and distancing. And we know that the nature of political engagement, discussion, is such that it's difficult to always do things in a remote setting. And it's tempting to do things organically when you're in close range to other people. And it wouldn't surprise me if there were lapses with respect to distancing and or masking. And that puts a lot of people at risk. This is not something that can be taken lightly. It takes one lapse to potentially lead to a chain of transmission that is widespread.
Tell us about some of the risk factors and comorbidities the president himself is facing. I mean, obviously, he is in his mid-70s. He's considered obese in terms of his BMI. He's overweight. So this makes this more complicated for him, I'm assuming.
There's no question. There's a remarkably interesting progression in terms of the likelihood of serious complications and mortality with COVID-19, literally per decade. So the 70 to 80 range and the 80 plus range are the highest range groups when it comes to risk of serious complications and deaths. So that's something that needs to be taken very seriously. Obesity alone is an independent risk factor for worsening outcomes with this disease. And in one study, it was shown that it increased the risk for needing ventilation by almost 50%. So this is not something that should be taken lightly. We certainly hope for his sake that he's not in a situation where he deteriorates, but time will tell. It's going to take the next week at least to see how things evolve.
The next week. So the fact that he is only, and we're just learning, he's exhibiting what the New York Times says is mild symptoms, which was some lethargy. He was lethargic, let's just say that. But that could be from a number of things. I mean, he has been campaigning a lot and staying up late at night. What symptoms does he need to watch for?
Yeah, this is something that is very, very unnerving with COVID-19. It's not uncommon at all to start your symptoms with something fairly nondescript, just feeling a little bit fatigued, a little bit of malaise, not having the energy level you usually have. And it can progress within a week or beyond a week to more respiratory symptoms and decompensation. I've seen that with a lot of patients who've been admitted to hospital who were just a little bit unwell, a week into their situation, and then they decompensated fairly rapidly. So he's going to have to watch things very closely. He's going to need good medical supervision for a while before we can feel fairly confident that this is not going to be something more serious.
CTV News infectious disease specialist, Dr. Abdu Sharkawy. Appreciate your time as always, doctor. Thanks so much.